Hello, I'm Dr. Mugdha Raut, a gynecologist and a clinical reproductive immunologist and co-founder of Dr. Raut's Center for Reproductive Immunology, India's only dedicated center focused on immune-related causes of infertility, pregnancy loss and IVF failures. We at Dr. Raut's Center for Reproductive Immunology treat couples with unexplained repeated pregnancy loss, unexplained IVF failures, and unexplained infertility with the active immunomodulation Emulate, which is our patented and branded process, and other passive individualized reproductive immunomodulatory treatments. We have our centers in Mumbai and many other cities in India. Today, I want to talk about a question that many couples don't even think of asking. Can the partner be a reason why pregnancy is not happening or not staying? Now, when we talk about infertility or repeated pregnancy loss, most of the focus is usually on the woman, her hormones, her uterus, her egg quality, her reports. But pregnancy is not a one person process. It involves both partners. And more importantly, it involves how the mother's body responds to the partner's part of the embryo. Let me explain. When an embryo is formed, it carries 50% material from the mother and 50% from the father. From a biological point of view, this means the embryo is not completely self for the mother's body. It is partially foreign. The rule of our body is not to accept anything foreign like infection causing bacteria or mismatched transplants. However, the pregnancy enjoys a special immunological status called immune tolerance, which means normally the maternal immune system adapts to this situation. It develops what we call immune tolerance. This allows the embryo to implant and grow into a healthy pregnancy. But in some cases, this immune adaptation does not happen properly. And this is where the partner's role becomes very important because the immune system needs to recognize and accept the partner's contribution. If this recognition or acceptance is inadequate, the body may not fully support the pregnancy. This can show up as repeated IVF failures, biochemical pregnancies, early miscarriages, or even pregnancy complications later. Now, here is something important. In many of these cases, all routine reports are completely normal. Hormones normal, uterus normal, embryos good quality, and yet pregnancy does not continue or does not happen. So, couples often ask, if everything is normal, then what is going wrong? Sometimes the answer lies in what we call an alloimmune imbalance. Allo means coming from another individual, in this case, the partner. So, an alloimmune issue means that the maternal immune system is not adequately responding to the partner derived component of the embryo. As a result, the embryo may implant, but the body may not support its continuation. This is why in some couples, even repeated IVF cycles with good embryos do not lead to success because the missing piece is not the embryo. It is the immune interaction between the mother and the partner's part or the material of the embryo. Now, this does not mean there's something wrong with the partner. It simply means that interaction between the two immune systems is not optimal for sustaining the pregnancy. And this is something that routine fertility tests do not evaluate. That is why, in selected cases, a structured reproductive immunology evaluation can help identify whether such an imbalance exists. Once identified, we can offer targeted treatment. At Dr. Raut's Center for Reproductive Immunology, we use Emulate, our patented and branded process of active immunomodulation, which helps the maternal immune system develop better tolerance towards the partner's contribution of the embryo. This is followed by individualized supportive therapy during pregnancy. The aim here is not just to achieve implantation but to help the pregnancy stay and progress. So, if you have experienced repeated IVF failures, biochemical pregnancies, repeated miscarriages, or unexplained infertility, and all your reports seem normal, it may be worth asking, is the immune system properly recognized and accepting the pregnancy? Because sometimes the missing piece is not in the reports you've done, but in the interaction that has not been evaluated. Thank you for watching. And if you would like to understand whether reproductive immunology evaluation may be relevant in your case, you may consult us at Dr. Raut Center for Reproductive Immunology. You can call or WhatsApp us at +91 9833201522 or visit our website www.icprm.in. If you found this useful, please like, share, and subscribe this video. Do share this with at least one person who may be benefited from this treatment. You may change their lives forever. Thank you.